The Honourable Leader of the New Democratic Party.
Mr. Speaker, I would like to table an interview this week with Dr. Margaret Fraser in Sydney, who said that emergency room patients are not getting proper care because no beds at all are available when they come in. When they were asked to comment, the Health Authority blamed the shortage of beds on an influx of patients at certain times of the year. Dr. Fraser, however, says the problem is not the time of year, but that there aren't any beds available in any of the 4 hospitals in the CBRM, so that the regional emergency department itself is having to function as a ward, something which, in her words, they are ill-equipped to do. So I want to ask the Premier if Dr. Fraser's view of this doesn't make basic common sense to him.
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable for the question. I want to thank all those across the province who continue to work day in and day out to ensure that Nova Scotia have access to primary health care and emergency health care. As I said to the Honourable Member at each question period, he raises this issue. We continue to reduce the wait list. Now it's been reduced by 53% since we've come into government. We've invested in home care in every one of our budgets to ensure that seniors who tell us they want to have that care at home, Mr. Speaker, we're providing that care at home. We're going to continue to work with our partners to make those investments. And as we go through this process, if it's deemed that we need to build more long-term care beds, we will do so.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, I want to return to Dr. Fraser's analysis. She also noted that the conditions in the emergency room at the Cape Breton Regional are, besides being uncomfortable for patients, they're dangerous for staff. In fact, in Dr. Fraser's estimate, treating people in hospital corridors is untenable. It's not a practice that allows doctors to properly perform exams on patients, and it shouldn't be continued. So I want to ask the Premier, Mr. Speaker, will he concede that Dr. Fraser here has a reasonable and a considered point?
The Honourable Premier.
Mr. Speaker, of course, we will agree that Dr. Fraser, if there's issues at the hospital that she's bringing forward, we'll continue to investigate those to work with her to ensure not only that she, but all healthcare providers have the appropriate environment to be providing the care Nova Scotians expect.